My name is Mohammed Mihim. I go by Mo. I'm the Associate Director for Clinical Research. I'm also the Division Chief for Hematology, Oncology, and bone marrow transplantation. I'm here to talk to you today about clinical trials and how to get involved in the University of Iowa. I joined the University of Iowa in 2007 and built a very nice clinical trial enterprise that accommodates all learners at different stages of their careers. Fellows can get involved with clinical trials by writing letters of intent, be part of writing a protocol and putting that through the different committees that need to be put through, and also be participant in a analysis of ongoing and clinical trials. We have a very large investigation group. These trials are written by our own faculty and sometimes by our own fellows. These are classified as investigator-initiated trials. There's a lot of internal funding that allows people to do that and allows people to have an ability to write these trials and put them together. For fellows that go through a fellowship of 3 years, it's very hard to write a trial and actually see it to fruition. And therefore, it's nice to kind of break it up into different pieces and sort of do the different pieces at different time points in the fellowship. I would encourage fellows to write a letter of intent for one trial, analyze a finishing trial, and write a protocol for a different trial. This allows them to touch the different components and the mechanics of building a trial, which then teaches them how to do a trial. In my professional opinion, it took me, it was one trial that I wrote, and once I had written one trial, I could do it many times over. Trials have different components that can be presented to a learner at different stages, and therefore I would encourage fellows as they go through their fellowship to write a letter of intent for one idea that they may have, maybe write a protocol for a trial that is already matured and has funding, and then potentially participate in the analysis of a trial that is completed. Through that fellowship, through that 3 years, it's very difficult for a fellow to really see their own trial come to fruition unless they're going to become faculty within that institution. But it's important for fellows to realize that the handoffs between trials can be done in a nice way where a fellow that wrote a letter of intent, another fellow could come in and write the protocol, and another fellow could finish the analysis based on teamwork that is done through the generations of fellows that come through our program.